So what we did in this specific study was that we wanted to know if using some scores like the visual acuity score will be able to manage to find the patients at higher risk of developing keratopathy, and so that these patients will need to be guided by an ophthalmologist. Belantamab Mafodotin, as you know, is the first-in-class BCMA targeting antibody-drug conjugate that has been approved for use in European Union for myeloma patients with relapsed refractory disease who are refractory to both bortezomib or proteasome inhibitor and monoclonal antibody plus an IMiD. So this is a very efficacious drug in this cohort of patients. However, we do know that more than 50% of the patients will develop some corneal problems, which is probably corneal epithelium changes, the so-called keratopathy. I believe that this is extremely important to find these patients as early as possible, especially when they develop blurred vision, dry eyes, and changes to the best corrected visual acuity score, the BCVA, as we call it. So what we did in this study, we tried to have comparison between the findings of the ophthalmologist and what we have seen in the BCVA score. And so we've seen that we had a very good concordance between the grading of the keratopathy that is found by the ophthalmologist and what we are doing regarding the presence of symptoms based on the visual acuity score or the OSD score. In general, I think that we managed to use these scores to suggest that the changes in visual acuity, ocular symptoms, and patient-reported outcomes should be investigated using the OSD and the visual acuity score as possible surrogate markers to help the hematologist and the oncologist detect the meaningful keratopathy and inform them as to when it is best to consult an ophthalmologist for a full ophthalmology exam while on Belantamab treatment. But I think this is very important because otherwise the patient needs to go all the time or at least every month to an ophthalmologist, which is not very easy. I believe with the results that I described in the presentation of EHA, it would be very easy for the doctors to detect those patients who are, let's say, eligible for a full ophthalmology examination, and possibly after a while will be able to use these scores in order to manage our patients without the every month ophthalmology test. This is our aim. We hope that we manage to do that and to achieve that using the scores that we describe in our poster.